Hey, hello everyone, and welcome to yet another Tooth Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your dental health, and do subscribe to our YouTube channel. You can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the Tooth Talk, I have Dr. Arun Jacob. To give you a brief introduction about Dr. Arun Jacob, Dr. Jacob is a Master's of Dental Surgery in Pediatric and Preventive Dentistry from the Manipal College of Dental Surgery. Passing out in 1992, he has 27 years of clinical experience in pediatric dentistry. He is a fellow of the Academy of General Education and has special interests in the management of special needs children. He specializes in the management of chairside conscious sedation and procedures under general anesthesia for child patients. He is the former Dean of RG College of Dental Sciences, Bangalore, India. Dr. Jacob is the recipient of the Star Pediatric Award by the Indian Society of Pedodontics and Preventive Dentistry for the year 2007. Dr. Jacob has numerous national and international publications to his credit. Currently, he is the Chief of the Dental Services of the American Mission Hospital, Bahrain. Jacob, sir, thank you so much for joining me today in today's Tooth Talk conversation.
It's my pleasure. And once again, thank you.
Yes, sir. So, what is the topic related to dentistry, sir, that you would like to share with our patients today?
Well, based on the present scenario, I really think coronavirus is the most raging topic. As you know, the coronavirus has been declared as a pandemic by the WHO authorities also. So I think it's of grave concern to everybody around. And also, it's of grave concern for a dental practice too. So I would probably like to talk on that today. Yep.
Yes. Great, great. I think it's really important that our patients know and understand probably even how as healthcare providers and how dentistry also being a part of that, how in the dental operatory or from the dental perspective, the kind of precautions they have to take, especially I think because since you deal with child patients.
Yes. So, so basically, now this is just for a small description about coronavirus, because this is for the layman too.
Yes.
The term corona is something like a crown. So microscopically, these viruses, there are spikes arising from their surfaces, and that's why they have been termed as the coronavirus. And these viruses have been actually detected many years back, decades back actually, in the mid 60s. And right now, what's of importance or what of concern is the role of the SARS-CoV-2 virus, which this is basically an acute respiratory syndrome virus that has caused the disease COVID-19. So, all over the world, as we all know, that it now recently was detected in China in December 2019, and it's pretty bad. So things have been, and it's really woken up all the public health authorities all over the world, and every country is taking its own precaution. For example, here in Bahrain, they're doing a remarkable job of trying to contain the virus here. Now, today I would like to focus on what exactly happens in the dental operation. This is irrespective of whether it's an adult or a pediatric patient who's coming to the operation. Yeah. So we do have many precautions to be taken both by the patients as well as the dentist or the dental care personnel. Yeah.
Yes. Yes. So there have been reports, sir, that this virus is present in the saliva of the infected patients. So how is that is pretty actually relevant for us as dentists, because we are constantly dealing with saliva and blood in the mouth.
Well, actually, now the issue of this virus being present in the saliva is based on only preliminary studies, because there are very few studies on this, and which has been recent for the couple of months. And there's been one concrete study from Japan, which actually, but the number of subjects that have been chosen are pretty less. So they have actually calculated it as 97% of that selected crowd of about 20 or 30 of them. And but 97%, the virus was detected in the saliva. Well, this could be attributed, so it could not necessarily be related from the salivary glands, minor or major salivary glands. It could be because of the nasopharyngeal secretions in the mouth, because the person is already having a respiratory distress issue. Uh, and probably it's due to the nasopharyngeal secretions that end up in the saliva, or also right up the lungs. Because of the celiac actions, the virus travels up. But whatever it is, yes, the virus is present in the saliva, at least based on the studies so far.
Yes.
So, yes, yeah. So this is of grave consequences, actually. So, in public awareness, like parents should instruct their children. First thing is your oral hygiene measures definitely at home, and which is not going to stop the virus, but in general. But then again, personal hygiene, like toothbrushes, suppose there is, if the child is staying in a community like a hostel or something, see that his brush is not his toothbrush is not misused by someone else, because this virus is supposed to be contained in the environment for a long time. They've not even now specifically specified how long, but it can be alive for more than 7 to 8 hours. Yeah, so that is of concern again. So sharing of common toothbrushes is a big no, which is of course rare but can happen. And then in children, even right now, I know all over the world the schools have closed and all that. But sharing of food, snacks among kids is a very common thing. So all these should be curtailed, and the parents should advise the children not to do that. Yeah. As for the dental visit to the parents, by the parents to the dental operatory, I would generally advise the public that only to go to any dental or medical hospital only if it is really necessary. Because these are all sorts of infection. It's like a big bed of infection there. So if it is for a routine checkup, kindly postpone your appointment. Yeah. And from dental point of view, if your child is suffering from severe pain, and if you already know the dentist, I think the first step would be to communicate over the phone, find out what can be done. Like, yeah, unless there are severe cases of infection where the swelling extends and there's a huge swelling on the face, which would require some attention physically on the patient. But besides that, most dental pain can be actually uh, what you call covered by an antibiotic and an analgesic prescription, which could be done over the phone instead of visiting your dentist. And again, I repeat, periodic, regular checkups can always be deferred. Yeah. Then the dental operatory. Yeah. Let's start with the reception areas. Right. Right now, thermal scanners should be used at the reception areas, because you have two things. One is a basic questionnaire or the bystander, asking them about their travel history and whether they have any fever, but that's not really concrete. Not everybody is going to come to a dentist and say, no, I didn't travel to China or wherever, and they're going to surely cover up about that. So it's not really feasible. And this virus, when it attacks, doesn't necessarily have to be a raging hot fever. It could be a low grade fever too. So the thermal scanners at receptions are the best option, one of the options, and I think they're now available everywhere in the market.
Mm.
And the other precautions are when a person comes to the public, he should wear masks. Now, the concept of masks, especially I've seen in a lot of social media, like people use a regular mask, which is not really efficient enough. It doesn't serve the purpose. So, ideally speaking, you have to use the respiratory masks, the respiratory ones here, and which has got a thin metal here. So once you fit it on you, you need to actually adapt it to your nose there. So this is contained within. So this is very, very important. I've seen in the social media even people covering the hand like this and walking around, which is really not do anything good. So that's the first precaution you take right now with the prevailing conditions. And besides that is your personal hygiene. And I should tell you that before the sanitizers, the best is hand washing with soap. And anybody look up, there are 5 easy ways to go ahead for regular washing. It's not just doing this, but there are 5 steps, which I don't want to expand here. You could refer it on YouTube or anywhere here of easy washing for the public. So these steps should be followed, and that would be the best hygienic measure, self-hygiene measure taken. And then, as you all know, we need to avoid crowded areas. So now in the dental operatory, we deal with patients, it's not only the saliva or whatever, we use machines that cause fine spray. What I mean is the aerosol sprays. So these are fine droplets which are floating naked, which we cannot see with the naked eyes. And these are a great source of infection. So, ideally speaking, the first thing is in the dental operatory now, the patient, before the arrival of the patient, every chair should be set up. Every chair in the dental operatory should be set up. And the first thing is the use of an aerosol spray, like aerosol spray, disinfectant, surface disinfectant. Most of these disinfectants have 70% isopropanol. So, and they are very good, and should be done for every patient, prior to every patient in the dental operatory. This includes the preparation of the dental chair and the surroundings. Yeah. And during the procedure, when we use a handpiece, and that is what we remove the decay in your cavities and then fill it again. But this handpiece is working on compressed air and water. So there is this fine droplets of things all over the environment. So ideally speaking, from the dental point of view, I would recommend all dentists not to use slow suctions, but use high suctions during the procedure. That would be it will be remarkably effective when compared to using a slow suction. Most of us do use slow suction for a regular procedure, but please start using the high suction for this. Yeah, that's one of the main things. And then definitely, I should have actually started with that. Is your protective gear, where
Yes.
the dentist, yeah, there is eye goggles. I mean, yeah, it's your face shield and your mask, of course. And the the lab coat is actually the white lab coat. The doctor's coat is misused because there's some people just walk in with the operatory and with the white coat and stay on from 7 to 7 in the evening wearing the same thing, which harbors a lot of infection. So I think the use of disposable gowns is a must. It's good for the doctor as well as the patient, especially during this prevailing condition. Yeah.
I'm sorry, I had my mic on mute. And sir, I was just wondering, just in case, if at any point there is a chance that the waiting area would be crowded, that we kind of reschedule the appointment so that the patients just walk in rather than wait in the area.
Yes. So usually, even if it's a crowded dental practice, even if you see a patient within a 30 minutes, it would be probably better to split it into a 1 hour slot. So even if a patient walks in a little late or there is some difference in the timing, you could adjust. But what happens usually in crowded dental practices, the patients pile up. So you can also advertise, because every dentist would be having this website and all that.
Yes.
And you should say that you would strictly go only by appointments and to call a particular number to hear. And you can also mention that walk-ins would be encouraged only if it is an emergency, a dental emergency. Yeah, that would be a great thing, instead of waiting in a overcrowded waiting area or a reception. Yes. Yes.
So, yes, sir. So, I think hopefully the coronavirus threat is goes off soon, and we'll all be again safe. But nonetheless, I think whatever you said about the precautions or the sterilization of the operatory that is required, more or less that is something as a routine practice, in a routine everyday practice, we more or less do practice all that.
So yes, and the only thing is it should emphasize that it's done in all clinics, because it is for the safety of the dentist and the patients.
Yes. So, thank you so much, sir, for telling our patients about the precautions, and also telling how your dentist would take precautions to avoid any cross infection or contamination. And I really hope that talk was helpful to our patients.
Hopefully.
Yes, sir. And thank you so much, sir, for joining me today and sharing your experiences with our patients.
Yep.
And
My
yes, sir. And I hope I can get you back to talk on our to talk for another topic related to dental and oral health.
Sure, anytime. At
Thank,
your service, madam.
thank you, sir. Thank you so much.
Thank you. It's been a pleasure. Thank you.
That was Dr. Arun Jacob Silas, who gave us information about the preventive measures that are taken in the dental operatory, and also the measures that our patients have to take in the wake of the coronavirus epidemic. I hope that was helpful. If you have any doubts or concerns, please do write to us. Do visit our website www.thedentaire.com to get more information on your oral and dental health. And until next time that I come back with another dentist with another topic on your oral and dental health, keep smiling and be happy.